To NURFM 103.7 today. I know a little bit earlier we were talking with our Professor of Education, John Fischetti, about education. Today we're talking with, he always comes in every week, our exercise physiologist, Mark Goswell. That I've got on the sheet that we're talking exercise things, but you also want to talk education. But the idea of us educating ourselves when we hit up any sort of health professional for some treatment.
Yeah, any type of treatment, any health professional. And I was actually listening to the radio on the way in, and that's what inspired me to think, maybe we should talk about this today.
Good to see you were weeks prepared for
coming.
Mate,
I am super prepared. But it's also something that I've seen this week and last week with all of my clients as well, is that, I'm getting people that are coming in that have been dealing with their injuries for 2-3 years and just not having the right treatment and the right guidelines and the right answers in terms of what they need to do. But a lot of that came around from the fact that they literally went to these health professionals, they went to these specialists, and they just took it for granted in terms of what they were saying was 100% right. And for these particular clients, they just weren't. They're getting the wrong information, but all it took was the client to actually take some ownership over what's actually going on in their condition, and it started to open up doors and head in the right direction.
Okay, so let's just pull that back a little bit. We've all seen doctors, we've all seen different professionals, like I know you're in the exercise field, and lots of others as well, right? I think that we have this barrier in our brain that says the professional I'm going to, they've got the certificate on the wall. They've studied whatever this is that I'm going to see them about. So the knowledge they give me is probably going to be for my best interest. Now, whether that is or ends up being the perfect solution for you is where we're going with this. But I think for us, that's the mental barrier we face.
100% it's the mental barrier. People sort of get taken back by the degrees on the wall and the pieces of paper and the all this gloating and carrying on about how good you are. But, mate, I always say to my clients, the realities are I've got a piece of paper, but you actually have no idea whether I got 51% or whether I got 100%, because no one checks your academic transcript when you've got a job. You are qualified to do a job, and then boom, you're done. There's no, I've been in the industry for 20 years, but how do people know whether I've continued my education and continued my learning? And that's what happens when you go and see a professional. Like myself, I continue to develop, continue to strive, continue to find answers, and that's what we're trying to do with our clients is, open up doors to be able to educate them on, this is what you need to do to improve your quality of life. And it's not just about exercise physiology, but everyone. Like if you're going to someone and they're giving you advice, question them, ask why.
I love how you mentioned that all the gloating that you say some professionals do. I think of something Jerry Seinfeld said once. He said that, if my guy's the best, this guy, they all can't be the best. Somebody has to be the worst in these fields.
Someone does have to be the worst.
And hopefully you're here to stay away from them. Okay, the idea of questioning and educating ourselves, but then I can hear the pushback saying, hang on, we are told so often that Dr. Google is not the place to go to. So if we're not doing that, how do we educate ourselves?
Yeah, but look, use Dr. Google, but don't use it as your go-to. Like use your Dr. Google to be able to develop questions that you can then take to a health professional. And so you don't have to say you got it off Google, but you can say, look, I've got a osteoarthritic knee and the information I've been provided is that I need to go running. And then you challenge the health professional as to, is that the best modality of treatment for me? And that health professional should be able to basically stipulate exactly what the best protocols are, why the best protocols are, what they should be, and how to follow them. And then, look, if you're getting that advice and you're not making notable changes within around 6 to 8 sessions with that client or with that practitioner, then they're probably not on the right track either. So question everything, question the people that you see, and they should have the confidence to be able to tell you what's going on.
Our exercise physiologist, Mark Goswell, going against the old phrase of ask no question, get no lies. Educate yourself, not about
Educate yourself, mate.
All right, Mark, we'll hear from you next time around. Have a great week.
Thank you very much.
2NURFM, a broadcast service of the University of Newcastle.